So without any more delay, let's get into what we are all here for, the final presentations, and let's have iVital come up.
Okay. Hi, my name is Dr. Natalie Shum, and I've been a practicing emergency room physician for over 12 years and the director of an emergency room for over 5 years. Due to the Affordable Care Act, ER volume has grown by over 50% across the country. In my ER alone, we've gone from seeing 90 patients a day to 200 patients a day over the course of 2 years. Not only that, but the game of reimbursement has completely changed. We're no longer fee-for-service. Now we're measured on metrics for quality, for efficiency, for patient satisfaction in order to get paid by Medicare. Who does this affect? It affects everybody. My doctors are coming to me and saying, we're seeing these big volumes, we're seeing big waiting times. This is too risky to practice in. The patients are saying, I'm waiting too long to be reevaluated. My satisfaction is at an all-time low. The hospital administrators are saying, I'm trying to spend more money to address this increased volume, but yet I'm recuperating less costs due to decreased reimbursement due to quality measures. What is the solution? iVital system. iVital system uses existing medical sensor technology, and it creates intelligence out of that raw data with a specific proprietary algorithm that we have created to enable the medical professionals to know what's important, to act faster, and to have better patient outcomes. This is a total system solution that is differentiated from any other software out there because of its domain expertise. Essentially, I'm taking everything I know as an ER physician and as an ER medical director, and I'm putting it into the software to have better outcomes and increased reimbursement. How does it work? We're not trying to reinvent new technology. Low-cost, medical-grade, FDA-approved medical sensors are already out there. We're using these medical sensors to place them on the patient to have continuous monitoring of heart rate, blood pressure, respiratory rate, pulse oximetry, temperature, and location by RFID. All of this data feeds into our unique iVital algorithm to alert the physician on when a patient condition changes, if they're improving, if they're deteriorating, or if they have a specific condition that requires specific actions in order to meet core measure compliance. Play with me for just a minute. Welcome to Rancho Campagna Emergency Department. My name is Dr. Natalie Shum, and I'm sorry to tell you, but our 20 ER beds are full. It's the flu season, and all of you who have checked in here are waiting in the lobby to be seen. Now, I know you may have been triaged some time ago, and over the course of hours, I have no idea which of you has a condition that has changed and which of you is getting worse in front of me. What is the solution? iVital. If we had placed a sensor on you, take patient Martin Shum up here. He checked in with a very low-level priority. He had a cough and a low-grade fever. iVital then sends me an immediate alert that his condition has changed. His pulse ox is dropping. His blood pressure is dropping. iVital is intelligent enough to say, this patient qualifies for an immediate bed in the ER, and he meets criteria for a code sepsis. And these are the actionable items that that physician needs to follow in order to be reimbursed by Medicare within the first hour of his stay at the hospital. What is the value proposition? Patient has better care, increased satisfaction. The doctor has lower risk, higher efficiency, and better outcomes. The hospital has lower labor costs and increased reimbursement because all of these things about quality, satisfaction, efficiency feeds into reimbursement. What is our return of investment? Well, we're using technology to decrease labor costs. We're talking about decreasing FTEs annualized over the year. We're talking about using our existing staff more efficiently. We're talking about millions of dollars in Medicare reimbursement and in addition to that, decreasing risk for potential bad outcomes and future lawsuits. iVital. What is the future of iVital? iVital is not just applicable to triage. It's not just applicable to the emergency department. This is a system that can stay with the patient throughout their hospital stay and potentially 90 days post-discharge. Imagine if you have this system in place when that patient goes to that skilled nursing facility and you have early detection to say, this patient's deteriorating. If you don't treat this patient, they're coming back to the ER and they're getting readmitted. And guess what? You're not getting paid for that readmission. It's within 90 days. iVital has the potential to save the hospital money on multiple fronts and the potential to grow as technology grows, sensor technology grows, increased data, creating increased intelligence. Thank you. How does it cut off? Okay, if nobody has any questions. Actually, is there any feedback from the audience? Do we have any medical directors in the audience who would like to give an opinion? One right here?
I'm not a plant, but I've got a question for one of the judges. When can we buy that dirt?
By the way, that's Dr. Davis, medical director of the ER here at St. John's.
So the cost per unit, approximately, and then what happens? Are these reusable potentially?
If we can go back to the slide on the individual component costs. So we're less focused on the cost of the actual equipment. As you can see, the components cost $1 to $2. On the next slide, you see a much fancier, well-packaged sensor where there's 3 on the market currently, where in the size of a Band-Aid, it measures all of those things at the same time, and it's already gone through FDA approval. That cost is much higher, though. What our value is in the software, though, and how that makes sense of everything and creates value.
So, Natalie, my role here is to give feedback from the panel, and many impressive things with the presentation. I wanted to share some of those. You really identified the problem statement really well. Clearly, you know the subject matter. You've identified the pain points. Also thought the vision was extremely strong, and the value proposition really good. Innovation of concept also really strong. So lots and lots of good stuff. There's a few questions though, and perhaps with more clarity, this will come cleaner. The algorithms that you talked about, understand the concept, but it feels a little vague. Can you share a little more specificity on what's in that secret sauce?
Absolutely. So with iVital, you're going to have preset algorithms across the board on what is normal for vital signs, what gets you in the orange range, and what gets you in the red range that requires immediate medical attention. Okay, so this works both ways. If I have, for example, I used a very sick patient, but what if I have an ankle sprain, or what if I have an asthma patient that comes in? Technically, the patient doesn't even need a bed. They come into the ER, they're in a sub-waiting room, and I tell iVital, he needs a breathing treatment, but alert me when this patient's oxygenation increases from 90 to 97%. So even though I'm over here managing a bunch of patients, I get the alert to my tablet, patient's better, I go over there, the patient never needed a bed, they never needed a nurse, and I can discharge that patient and stay within that length of stay for level 4 or 5 patient as mandated by core measures. So there's all ways you can set the algorithm. So preset algorithms for dangerous vital signs, and then physician set algorithms based on the medical condition.
Okay, thank you. And I had 2 other questions. One was in regards to the transmittal of this information. You talked about it moving to your iPad as an example. What's your business model on how you'll get the information from this monitoring device to other systems?
So if I'm correct, all of this is Bluetooth wireless. Is that right? Yes. I'm not the tech person here. But if we were to extend iVital to, say, nursing home monitoring, we have spoken with Mr. Fountain and his boss. I don't know if he's here.
Basically, we can leverage the long-range, low-power radio to transmit the signals and the information. And that specific type of network is designed to carry these low bandwidth data over a
not being done today.
And because the technology is available to monitor and to transmit continuously over the long distance or short distance, depends on the time period that we're looking at.
I was taking a little bit of a look on the internet beforehand, and I noticed that there was some patches that are used for telemetry of, for the most part, heart rate and things like that. Are you mentioned you were using off-the-shelf components. Is that one of the components? I didn't see it in the picture.
Yeah, we have a picture there. There's 3 different patches that already exist that are monitoring. And I would say the differentiator is not that it's just the continuous monitoring, but it's the algorithm that we're using to make that meaningful.
Again,
Because you can monitor patients continuously and send alerts to their cell phones, oh look, my oxygen is dropping, or send it to their loved one, right? But how are we using that to actually change the way we practice medicine and change as regulatory compliance changes, as mandates from CMS changes?
This sounds really good. Did you get a chance to model anything here this weekend?
To
To
because
send
we're
a
not.
pulse rate or anything?
Well, we did. We made something with a 3D printer, but the thing is, it's so cheap off the market that we didn't feel like we needed to prove that we could make the technology that works. We actually have an example that works, just continuously monitoring of the heart rate, but that's part of the process, and one of the uncertainties that we need to look at is researching and validating the various sensors on the market for accuracy.
Over the weekend, over this weekend, can I just over the weekend, we validated that we can measure the pulse and we can transmit it using Bluetooth, technology to a nearby device, where this signal can be collected, aggregated, and sent out using Wi-Fi, for example, or long-range radio. And we also validated the software component, that we can actually grab the data, send it to the cloud, use the intelligent algorithms, artificial intelligence, machine learning, and so on and so forth. And we can also push the data from the cloud to the devices that the doctors and nurses will use.